Hi guys, welcome back to the channel. I'm here today with a special mystery guest. It's...
Hi guys, I'm Francesca Martin. I'm 22 from South Wales and I'm a model.
So Fran, why don't you tell the guys at home a bit about what brings you into my chair today?
I think that I really want to feminize my face a bit because I think I'm seen more of an androgynous model and person than a trans woman, and I would like to change that. As though I do like my androgynous features and would like to keep some of them, I do want to like feminize my face a little bit, you know?
Sure. Do you feel like that's more for your work?
I feel like more for my work and more for like just being comfortable and feeling myself, I guess.
Okay, that's cool. Okay. And was there anything specific that you were thinking that you would like to change or alter?
I mean, I think my temple is the main one. Like, I have obviously a breastbone, which is quite masculine, but I would like to also have maybe my lips and cheeks kind of area done and correct my jaw, as I had surgery, and it's just a bit like wonky now. So, sadly.
What kind of surgery did you have?
I had my jaw broken, like here and here, and like brought forward because I had an overbite. So
Okay, so that was like to do with the position of your teeth.
Yeah, it was like surgery that I needed, not like wanted.
Okay, and when was that?
2 years ago.
Did you have braces then?
Yeah, I did.
Okay, and cosmetic treatment wise, tell us a bit about that.
Wow, I was swollen for like a month. It was very painful, but it was not that bad. I don't regret having it done because I much prefer my appearance now, but it obviously did leave my jaw looking a bit funky, so that is a problem.
So, have you ever done any kind of non-surgical stuff before?
Yeah, I had my temples and cheeks done before, and that's about it, really.
Okay, so nothing else.
Yeah,
Okay.
apart from laser, but that's
Okay.
it's nothing.
And is there anything that you're kind of particularly worried about or concerned about?
I have no concerns really. Yeah.
Boring. Okay, fine.
I mean, I'm not mad. You can kill me.
Okay, so what I think I'm going to do is just grab the iPad for you,
Okay.
and then we'll just like talk through which bits we can tweak and
Okay.
alter. But I'm going to give the iPad to you.
Lovely.
Okay, so Fran, I'm going to give you the iPad.
Amazing.
And then you can let me know where it is that you were thinking you'd like to change.
Definitely.
It's magic pencil.
Oh, okay, lovely. Do I draw?
Yes.
Oh, okay. Definitely here. Here. I also, yeah, I think like by here is a bit flat too. I feel like you right now. It's so fun.
Well, that's the whole idea. I agree with everything, by the way, so far.
I think I should be a practitioner.
You should. I said to the other guys who've done this so far, I'm just going to go home, I think, and then you can just carry
retiring.
on.
I think here, and I think that one's flat, but I don't know.
When you say here, do you mean
The
sort
the
of...
dip.
Oh,
Do you know
this
what I mean?
depression right there.
Yeah,
There. Is that what you're talking
that's
about?
like that dip there. I feel like it's like flat, like straight there, but it goes wonky here.
So just a bit of asymmetry.
Yeah. My lips are really weird by here too.
You mean not quite full enough?
Yeah, I
in
don't
the
think
bottom?
like full enough. I feel like the top could be fuller too. They're not the smallest, but I feel like the top is also kind of flat, and the bottom is not symmetrical really. And my chin, I feel like, is also really flat and square, which I feel like is quite masculine.
Like you could put some here in the center, and that will just give like a little bit of a pinch to the
Yeah.
tip of the chin, which would look quite nice. It doesn't show quite as much here as it does in person.
Yeah.
Actually, so here it looks, you know,
Not as bad.
yeah, like not as flat. But yeah, I agree. Maybe doing that, and then maybe also some in the crease of the chin point here
Okay.
as well. Do you remember when we were talking about the ideal size of the lip and we did some measurements, and actually the distance in between your eyes, it's reasonable. So the width of the mouth should be the phi, ideally, of the distance in between the eyes. So really it should be a bit wider. So I think we can make it both wider and fuller.
Okay.
Actually, you've got a lot of scope.
Really fab.
Yeah, everybody
Amazing.
loves that.
I love lips.
Make them bigger.
Please.
Okay. Well, yeah, go on.
Oh, sorry. I also feel like fuller in like the center would make my face look more feminized too.
You mean
maybe
this section here?
Yeah.
Like there.
It would just like
and there.
push it out a bit.
Yeah. Let's have a look. Yeah, I agree with you because there's like kind of flat. Yeah, I think
that's very flat face.
That's all good.
Amazing.
Yeah. So, let's go and do it.
Yay! I'm really excited.
Okay, so let's start off with some Botox, and we're going to do the classics. So we're doing the glabella, the forehead, and the crow's feet. Switching over to some Ultra 4, we're going to do 1 mil per side in the temple, and switching to Juvederm Vollift to do the forehead, we're using a total of 2 mils with a cannula. Going back in there with a bit of Juvederm Volbella just to blur the edges slightly. Going over now to using some Teosal Ultra Deep. We're using a cannula along the cheekbone. That's 1 mil both sides. And then using Teosal Ultimate with a cannula to the front part of the cheek. We're doing 0.5 mil per side, and then 0.5 mil just underneath the cheekbone per side. That wasn't quite enough for me, so I went back in with the Teosal Ultimate and again repeated that with just 1 syringe. So that's taken us up to a total of 10 syringes. Switching it up now, doing some Juvederm Ultra 3. We've got 0.5 mil per side on the base of the nose, and then 0.5 mil per side in the front part of the cheek. We're going to use some Teosal Ultra Deep in the chin point, and we're using 1 mil there. And then we're going to use some Ultra 3 with a cannula along the jawline, 0.5 mil per side. And then we're going to flip that backwards, same entry hole, but this time going back towards the angle of the jaw and using 0.5 mil per side there. So that's taken us up to 15 mils in total. So Ultra 3 now for the lips. I'm going to go along the edge of the vermilion border. A lot of people ask me, why do you prefer this? Why are you using that instead of the Vollift? It depends on the case and exactly what I'm doing. So the Ultra 3 is a bit of a firmer product. So for somebody who does need maybe that little bit more definition like she does, because we are going for like a hyper feminine look, the Ultra 3 is a lot more appropriate. So I'm doing that with a needle and then going into the Glauco Klein point on the upper lip. And then we're going to do some tenting to the middle third of the lower lip. So I put a couple of syringes in there. And finishing up using some Juvederm Vollift to the forehead with a needle, just to touch up any areas where there's a slight discrepancy. So that's a total of 19 mils. But that wasn't enough. So we also decided to do some skin improvement. So we pop some topical anesthetic on her, and then 45 minutes later she comes back and we do an intracell treatment. This, if you recall, is skin needling combined with radio frequency. So we do 2 passes with this treatment. One is a bipolar and one is a monopolar. And the difference between the two is basically the monopolar, the energy passes from the probe all the way to a pad on your back. And then with the bipolar, it passes between the needles, so it's very superficial. What that means clinically is the monopolar is very good for lifting and firming and tightening the skin, whereas the bipolar is better for skin textural improvement. So welcome back.
Hello.
Hi. So how did it go?
Amazing. Obsessed with my face. Love it. I feel gorgeous.
Well, that is a very, very good sign.
Yeah.
Did you get much in the way of bruising and swelling?
I had my lips bruised quite a bit, and I had like slight bruising here, but apart from that, nothing really. It was not too much.
Where was the bruising on the lip?
Underneath my bottom lip, and slightly like in my lip on the top.
I suppose we did do quite a lot of little injections down there in the bottom lip.
My chin was a bit big as well. I look like Robbie Rotten.
Who is that?
From Lazy Town.
Okay, no, that's me. I don't no idea who that is.
I'm so sorry. Okay.
Okay. And did anybody notice?
I mean, when I first had it done, people would notice, but now no one can really notice. Unless I show a picture.
So do you think they noticed because, like, you were swollen?
Yeah, they definitely noticed because I was swollen, but yeah, no one really notices now. It's very minor, obviously, what you did, but it really did make a big difference.
Would you do it again?
100%.
100%?
Yes.
Which was the best bit for you?
I love my cheeks and my chin because I used to hate how flat and just manly my chin was. So that's really made a big difference to how I feel within my like transition and womanhood, I guess.
I think it looks really cool, actually.
Same.
Like the shape. I'm really pleased.
Same.
I love the forehead. That's my
Oh
favourite.
yeah, same. I love the forehead too. That's also my favourite.
It's also hard to pick. 'cause
My whole face is my favourite.
I'm just loving the whole thing, actually.
Same.
The whole thing. How long do you think it took for all the swelling to settle?
It took about a week completely for everything to like look normal and be able to wear makeup. But I feel like it's kind of been changing for it was kind of changing for like 2 weeks, I guess.
You mean like, so you could wear makeup after a week, and then after that it was
like
still
slightly
settling?
Yeah, still settling.
Okay.
Now it's like perfect, but yeah, I feel like my chin was quite swollen for at least like a week or a half. I don't know, a week and a half.
That's often the worst place, actually, the chin, because it's quite a tight space. A lot of people say that.
Yeah, I loved it though. Obsessed. Need it again.
Okay, guys, so that's all we've got time for this week. I hope you enjoyed the episode. Join us again here in 2 weeks' time where we will be seeing another patient. I'll see you again then. Bye-bye.